So we just looked at cardiovascular disease and the buildup that can happen and the development of atherosclerosis. So what are some ways in which we can reduce our risk for it, at least from a dietary standpoint? Okay. If you want to reduce your risk of developing cardiovascular disease, especially if you have a family history of it, the biggest one is really just replacing your saturated fat with unsaturated. I mean, that seems like a pretty obvious one. Limit the trans fats as much as possible. We talked about it earlier, but it can exist in some forms, in some foods that are manufactured. And I'm not saying get rid of all of it, but limit it as much as you can. You want to eat fewer solid fats. Remember, those are the things that are going to have more of your saturated fats. Again, they're more animal-based, more solid at room temperature, right? Hydrogenated oils or partially hydrogenated oils, which can be just as bad. Stick margarine is just an example of something that has a lot of partially hydrogenated oils. And all that means it's just been added with some hydrogens to it. Eat 8 ounces of seafood. Why do you want to do that? Because it has the good fats in it. Okay? It has those omega-3 fatty acids, DHA, EPA, those things that are fantastic for brain health, and a number of other things. Eating fiber. If you eat fiber, right, that fills you up a little bit more. You don't consume as much. You're going to hopefully consume less saturated fat in that regard. And then the last is just consume less alcohol, especially if you're, a pretty serious drinker or a binge drinker. No more than 1 to 2 drinks, depending on if you're a woman or a man. I don't get into a whole heck of a lot of diets, but I do talk about them sparingly here and there. I don't like the D word. I don't like the diet word because people tend to have a negative connotation with it. But here's one where this is a study, and you can see it's back in 2020, okay, and it looked at the Mediterranean diet. And with this, it was actually shown, and it was published in the British Medical Journal, Gut, found that eating the Mediterranean diet way for just 1 year altered the microbiome of elderly and improved brain function and aided longevity. This Mediterranean diet inhibited production of inflammatory markers, of inflammatory chemicals. This further exacerbates, causes the development of chronic diseases like atherosclerosis, diabetes, cancer, dementia. So if you're really looking for a diet that is healthy, that has been shown in studies to be helpful on all fronts, really the Mediterranean diet is really where it's at. Again, when it comes to diet, it's all about adherence. Adherence is the science. If you can find a diet that you can adhere to for the long term, damn, stick with it then. Okay, if you're a keto zealot, be a keto zealot. Okay, no big deal. Aside from diet, there's some other lifestyle factors. And one of the most important ones is really, moderate physical activity. And we'll talk about this later in the semester when we talk about activity level, physical activity and exercise. But getting some moderate physical activity at least 5 days a week. And we'll talk about all the specifics with time and whatnot later. Balancing energy in with energy out. How much calories do you consume and how much calories do you put out? If you're not putting out as much as you're putting in, you're going to gain weight. So pull back. Achieving a healthy weight, reducing your blood cholesterol levels, your LDL, your triglyceride overall levels, raising the good. If that's too hard, and it can be for some people, then there are drugs, there are statins. Statins interfere with the metabolism of cholesterol, thereby reducing LDL and triglycerides. They come with issues. Zeta is a drug that inhibits the intestinal absorption. So we have a couple different medications. One inhibits absorption and one interferes with metabolism of. What are some other I mean, you know, this seems like, oh my God, I don't want to take medication. It comes with a bunch of nasty side effects. I, for some reason, don't want to exercise and I don't want to stop what I'm doing. Okay. Well, what else you can do? Well, weight reduction. You can, achieve that healthy body weight. Weight reduction can reduce a weight reduction of around 5 to 20 millimeters of mercury for every 22 pounds of weight that is lost. So that can help with high blood pressure, the buildup of arterial and atherosclerosis. The DASH diet has been associated with helping to lower blood pressure. And it's a diet specifically to reduce sodium. It's been shown to help lower blood pressure as well, 6 to 7 millimeters of mercury. Physical activity reduces your blood pressure by 2 to 5 millimeters of mercury. Limiting alcohol consumption reduces your blood pressure around 4 millimeters of mercury, anywhere between 2 and 4, I believe. Hibiscus tea has been shown in studies to reduce risk of high blood pressure, 7 millimeters of mercury. So, I mean, there are a number of healthy things that you can really, really, really do to help health, high blood pressure, lowering atherosclerosis, or the potential development of. So there's a lot of things that you guys can do if activity and energy, balancing your energy in and energy out is not your bag.